Thank you for accessing this online mentor update. This short video has been designed to help keep you active as a mentor and to facilitate reflection of the mentoring process. After you've watched this video, you'll be directed to a quiz which will complete your mentor update, and you'll also be able to print your certificate of recognition. The NMC, the Nursing and Midwifery Council, outline the requirements for mentors to remain active and in date in order to effectively support students in clinical areas. These requirements are found in the NMC's Standards to Support Learning and Assessment in Practice. The standards fit around a framework which outlines the 4 stages of mentors and the 8 domains each mentor has to demonstrate. It's likely that you are either a Stage 1 or a Stage 2 mentor. The difference depends upon whether you have completed the mentorship course or not. If you have, then you will be recorded on the local register as a Stage 2 mentor and are able to make assessments about student competence. If you haven't completed the mentorship course, then you will be a Stage 1 mentor and should reflect the requirements in the code, which includes the important point that registrants are expected to support students and colleagues' learning to help them develop their professional competence and confidence. Another type of mentor is a sign-off mentor. You are one of these if you are a Stage 2 mentor and have completed extra local training to prepare you for mentoring students specifically on their final placement. A sign-off mentor is categorised under Stage 2 of the NMC framework. All mentors, regardless of which stage they are required to attend an annual mentorship update such as this one. Next year, you need to attend a face-to-face mentor update to meet NMC recommendations. The purpose of updating annually is threefold. Firstly, so you have current knowledge of NMC-approved programmes. Secondly, so you are able to discuss the implications of changes to NMC requirements. And thirdly, to have the opportunity to discuss issues related to mentoring, assessment of competence, and fitness for safe and effective practice. In addition to an annual update, Stage 2 and sign-off mentors are required to complete a triennial review document once every 3 years. You need to be able to demonstrate that you have mentored 2 students over a 3-year period to achieve the triennial review requirements. The PEF team can supply you with a triennial review document if you need to complete one this year. Remember, if you are a Stage 1 mentor, then you don't need to complete a triennial review. Student assessment competencies, or learning outcomes, are listed under 4 NMC domains, namely professional values, communication and interpersonal skills, nursing practice and decision making, and leadership, management and teamwork. The outcomes are the same for each year of the nursing course. They simply become more difficult to achieve the further into the course a student gets. Most student documents are now electronic and located on the PAIR website. If you haven't yet gained access to it, then let your PEF team know and they will arrange this for you. Timesheets are now exclusively electronic and found on the same website, and they need completing weekly. The documentation and assessments you need to complete for each student depends upon the type of placement they are on. There are 2 types of placement, a hub or a spoke. It's easy to tell the difference between the 2, as a hub is more than 4 weeks long and a spoke is between 1 and 4 weeks long. A spoke placement is loosely classed as an experience for the student, whereas a hub is a more formally assessed placement with additional review points, such as one midway through the placement. A short visit is usually a day or a couple of days in an area which is complementary to your speciality, although this is not essential. If you aren't sure whether your student is on their hub or their spoke, then ask them, as they should know. If not, then your Education Link Nurse or PEF will tell you. In your area, do you know who allocates mentors to students and who organises their off-duty? Students are required to work alongside their mentor or mentors with either direct or indirect supervision for 40% of their placement. This is to allow you time to properly assess the student and be able to give them constructive and timely feedback. So, how many mentors should an individual student have? Does it make any difference if they are on a hub or a spoke? The answer is that all students are allocated 2 mentors, regardless of the type of placement they are on. The type of placement does, however, determine which stage of mentor can be allocated. Stage 2 mentors can be the mentor for either hub or spoke placement students, and that includes being the main or the backup mentor. Stage 1 mentors can be the backup mentor for a hub placement student, or either the main or backup mentor for a spoke placement student. If your student is on their final placement, then the main mentor must be a sign-off mentor, or a sign-off mentor in training. What happens then if there are more students allocated to an area than there are available and in-date mentors? The NMC say that individual mentors can have up to 3 students at a time. This should be a rarity and only happen in unusual circumstances, such as sudden and unexpected loss of mentors in an area. Your student capacity is determined by the PEF team in conjunction with the education link nurse for your area, and there are many factors that determine this capacity. These factors include considerations such as the size of the placement, the acuity of the patients, and the number of mentors. So you can see that the number and type of students in your area may fluctuate from time to time. It's important that you're confident with decision making when mentoring students, as your decisions and judgments determine whether a student achieves their outcomes on your placement or not. Let's look in detail at a scenario that you may experience, and then let's discuss the possible options available to you. A student in the 2nd year of their course is currently on the 3rd week of a 6-week hub placement, and you are their mentor. It is becoming apparent that he often arrives late for shifts and has been off sick twice already. The first time he was off sick, he followed the correct procedure, but the second time he phoned the placement half an hour into the shift to report that he wasn't coming in. You've already spoken to him about wearing fabric trainers rather than shoes that comply with the uniform policy, and so far he hasn't changed them. Other staff members are now commenting to you about a general decline in his appearance. For example, his uniform tunic is very creased and he doesn't always display his ID badge. His clinical skills and nursing knowledge are impressive, and he's consistently complimented about his natural, caring approach from staff and patients. Should you A. sit down with him today and have a frank conversation about his sickness, timekeeping and appearance? B. see how he goes over the next few shifts, and if there's no improvement, then speak to him. C. print the uniform and sickness policies and give them to him to read as an icebreaker before discussing the issues with him. Or D. ask your area's education link nurse or PEF to talk to him with you about his sickness, timekeeping and appearance as soon as you are all available. So, lots of choices and a decision for you to make. Which option is the best one? Which one did you choose? The answer is, it depends. It depends upon your own confidence and abilities in situations like this. You may be very experienced, in which case you may choose to tackle the issues head on and have a frank conversation today. You may prefer to give him the policies, as you like this way of making sure he's aware of what you'll be discussing with him. If you're not very experienced or feel your skills don't lie in this sort of area, then absolutely ask the PEF or the link nurse to help or even lead the conversation. Don't forget that there will be a university tutor linked to your area as well, who will also be more than happy to support you. The only option that's probably not the most useful is the one where you wait and see, and the reason for this is, at this point, you have already had a conversation with him about his footwear with no effect, and most likely you will have already had 2 return to work discussions following his episodes of sickness. So he has had lots of opportunities to tell you if he's having difficulties with, for example, transport to work or finances, although always be mindful that the root cause may be a sensitive subject for the student and they may feel embarrassed talking to you about it. However, now is the time to act rather than to wait, especially as your colleagues have also started to comment to you about him. You will notice that there was no option to ignore his behaviour and appearance. As a mentor, you are assessing professionalism in every placement, regardless of whether the placement is a hub or a spoke, or if you are a stage 1, 2 or sign-off mentor. However you decide to approach this scenario, or any similar ones, it's always very important to be open and honest with the student about the issues you need to raise, using real examples to illustrate your points. It can also be important to offer the student some encouragement about their nursing practice to help balance difficult or uncomfortable conversations. We all tend to focus on the negatives rather than celebrating the things we do well. So sometimes it's good to remind students of their positive qualities while still making sure that aspects that need addressing are done in a timely and sensitive way. One of the most crucial aspects of a mentor's role involves making decisions about a student's progress. Providing regular feedback that's constructive and understandable for the student is very important, as this allows students to know your expectations and the standard that they are achieving. You may, from time to time, mentor a student who is experiencing difficulty with, for example, their communication skills. Ignoring gaps in student knowledge or skills is not an option, and mentors are expected to address issues at the earliest point. This is only fair for the student, as they need to know what the issue is and what the plan is to help them improve their practice. So, having open and honest conversations again is key, as well as ensuring that all additional discussions are recorded in the student's documentation. If you feel that an issue, for example, a lack of proficiency of a clinical skill, is serious enough to warrant a written action plan, then it is important at this point to discuss this with your student and also to inform the PEF team and the link tutor for your area. This is to ensure that, as well as the student, you receive adequate support, as generally, but not always, action plans are seen as fairly negative by students, and it can be quite an anxious time for both student and mentor. What strategies are available for you to use to support a student with an action plan in place? If you've written the action plan, then it is likely that you have included in the plan ways in which the student can be assisted. Each plan should be unique and tailored to your student's individual needs. It's important that a review date is indicated so you both are working within a timescale. You might decide to ask a colleague with a particular skill to supervise the student. For example, if a student was having difficulty with their pressure ulcer identification, then a tissue viability specialist nurse might provide a useful short visit to boost the student's confidence. It's up to you as the expert in practice to decide the best course of action. It's quite rare for a student to actually fail a placement, but it does happen. If you are satisfied that you have put in place sufficient support and given timely and direct feedback to a student in difficulty, it is possible that they still might not reach the required standard. You must inform the student of your decision and be very clear in your reasoning and rationale, giving specific examples to ensure their understanding of your decision. It is never a pleasant or easy discussion to have, and sometimes it's useful to make notes before you start the discussion. Students and mentors may become upset at such discussions, so remember you can call upon the PEF team, your educational link nurse, or the university tutor for your area for support. If you feel you are comfortable conducting a potentially difficult interview with a student alone, then this is absolutely fine. But please do let the PEF team know the outcome straight away so that we can be available for support and also to provide liaison with the university. I'm sure we all remember when we were students and the difference that a mentor who was enthusiastic and interested made to our learning. Taking the time to teach students clinical skills and providing opportunities to enhance understanding in practice motivates inquiring minds. One of the most important aspects of being a mentor is being a role model for students. Students are encouraged to observe their mentors in clinical areas, watching your approach to care delivery, your interpersonal skills, your appearance and your leadership. They will then copy what they have seen and adapt the actions you have demonstrated into their own professional practice. Mentorship, therefore, is paramount for ensuring a high standard of evidence-based practice is passed from generation to generation of nurses. By involving yourself with the assessing and teaching of student nurses, you are gatekeeping the profession and protecting the public. We would like to take this opportunity to thank you for your vital contribution to securing the quality of the workforce of the future.